today we have Dr. Bharath Reddy with us. He is a pediatric pulmonologist from Bangalore and director of Shishuka Children's Hospital. He's also a global youth leader for child health for the International Pediatric Association. He deals with children's lung issues on a daily basis, so a fitting person to talk to in these troubled times. Hello, doctor. Thank you for offering to do this session with us. We've been seeing quite a few questions coming in on various HealthifyMe platforms from worried parents about their children and the coronavirus pandemic. So we wanted to put these questions across to you. I guess the first one is, of course, how likely are children to get coronavirus compared to adults? Are they more likely to catch the virus?
See, this is a very common question which a lot of parents probably have, because as parents, we're always very worried that our child is going to catch this deadly virus, right? Let's start off with understanding why we're so worried about this coronavirus compared to the flu virus, right? Flu is something which has been there for quite some time, H1N1, all these have been circulating. But why have doctors sounded the alert? Why has the WHO sounded the alert about this coronavirus? Is one, it is a more serious virus. The effects that it's causing is much more in adults, but also because it is highly contagious, right? So what the data shows is that this coronavirus is more contagious than the flu virus, and it spreads much, much faster. So the number of people who can get affected by coronavirus is much higher than with a regular flu virus. So that is one of the primary reasons why this whole lockdown is one of the solutions to prevent the spread of this virus. If it was only like a regular flu, then we don't have to lock down everything because the spread is not as much. So what does it mean for whether kids are going to get the virus or who's going to get the virus or not? This is something which is not predictable, right? Everybody can get the virus. Anybody who comes in contact with somebody who is infected or carrying this coronavirus can get the virus. So kids are not exempt from getting the virus from an adult or getting the virus from another child, right? So everybody can get it. And as I said, this is so contagious that it's very easy for us to contract it if we are within 1 meter of another person who's carrying this virus. But what we need to remember is that a lot of people, many people who carry the coronavirus world over are asymptomatic. Is that they don't have symptoms of fever, cough, cold, or what we talk about as the regular corona symptoms. It is not seen in a lot of patients. A lot of people are carrying it, which is why it is again more scary and dangerous, because the person who's sitting next to you, who's probably completely well or completely fine, can still be having the coronavirus, and you can get it much more easily, which was why schools were shut down very, very early, because it is very important that kids come in contact with a lot of other children and they stay within close contact of each other. You can't keep them away from each other very easily. So they can spread the virus much more easily. So let us say the kids are not exempt from it. But what is the silver lining in this whole thing is that world over, we've got data from China, we're now getting data from Italy, US, everywhere, which show that the severity of this virus in children is very, very low, right? This is it's quite surprising even for scientists for us to understand, like, why is this virus not affecting children as much as it is affecting adults or older people? So this is still being studied. Nobody knows why children are being protected from this virus, but they are. And that is a very good thing for all of us across the world. That's saying that even if a child is getting the virus in Italy or in China, they're not developing severe symptoms. And that is a very good point for us, especially because children are very difficult for us to contain at home and difficult for us to maintain social distancing, is that most of them, more than 90 to 95% of them, are having very mild illness. Even the deaths in children reported in China is very, very low. So let's remember, China has published their data on their pediatric population. And of that total 80,000 cases which they reported, there was only one child who died, right? So that itself shows that children are somehow protected from this coronavirus. So as a parent, yes, I hope this point makes you understand that you can be confident and be hopeful that this will not impact your child as much. It does affect adults. It does affect older people. The maximum deaths and the maximum critical illnesses that we see are all in older age group, especially elderly who have other conditions. For example, like hypertension, if you have associated diabetes, if you have chronic kidney disease, you have liver disease. These are the people who are more prone to develop severe forms of coronavirus. Fortunately, our children don't have problems of hypertension and diabetes that much, so they are relatively protected. And as long as we're keeping them safe from people who are carrying the virus, let's hope that children are able to tide over this crisis much better than any of us adults can.
Okay, yeah, that definitely sounds like the silver lining and a positive message for parents. Coming to the risk factors, are there any particular risk factors for children that parents should be aware of?
So, as I said, the risk factors are children who have other conditions, right? So, if a child has other conditions like, let's say, asthma, or the immunity is low. Now, when we say immunity is low, it does not mean that your general perception that your child is getting respiratory infections very frequently. We're talking about actual conditions where immunity deficiencies are there. Like we know children with HIV, we have children with immunodeficiency conditions, which by genetically we have proven that their B cells or T cells are non-functional. Children who are undergoing bone marrow transplantations, children who have kidney diseases, children who have liver diseases, these are the ones who we are really, really worried about, right? Because they can develop more severe forms of the coronavirus. But again, even in these children, like today itself, I was reading a report by UK doctors. Many of our pediatric doctors in the UK are putting up data. Even these children are not seeing severe forms of the disease. They are getting the disease, they are recovering, but it's not going into severe forms where we're seeing these kids also die. Again, a silver lining, but these are the children who are at risk. If you carry any other comorbid condition, which can predispose you to develop this virus.
That's informative. Coming to prevention, prevention seems to be the advisory across the board. So, what are some of the prevention measures that parents can take to protect their kids?
So, as I said, prevention of getting the virus is more important, because once you get the virus, what we're going to do about it is different. Agreed, children are protected, but that does not mean that we can take the risk and allow our children to get this virus, right? So prevention, as we say, is the best way. The first important solution which our country has taken up, which is a very big step, is the lockdown, right? So this, in a large sense, is going to prevent the spread of the virus, because it's very difficult to say there is no crowded place in India. Anywhere you go, people will flock up, and even if you just let this curfew go, people are going to come onto the streets very easily, right? So it spreads so fast. So our very important thing we need to understand is to stay at home. That is going to be the best preventive measure, at least for the next 1 month. So what we're doing is we're just buying time, because the virus is at its peak right now. So if we buy a little time, then the chance of this virus dying out slowly is going to be there. It does not mean that it's going to go away before July. It's going to be there for quite some time, but our chances of getting it by numbers starts becoming much lesser. So first step for prevention, most importantly, is to strictly follow the lockdown and stay at home. Keep your kids at home. I know this is the most difficult time for parents to keep kids at home. That is the most difficult thing to do ever, right? So that is something which is going to prevent it. I was very shocked to actually see a lot of parents in the hospital who had recently traveled to their hometown, recently traveled to their villages. This is something which is not acceptable, right? When there is a lockdown imposed, you need to not take the risk. They say that we're going only to the village doctor. How are we going to get the virus from the village? It's not true. We do not know that where the virus has already spread in the country. We do not know who are secondary contacts in this country. So it is highly advisable that people do not travel anywhere at this point in time. Agree, the curfew is much stricter now, but do not get out of the house. The second important problem I see is with apartment complexes, right? People think that just because you're living in an apartment complex, everything inside the apartment is protected. It is not true. I see parents sending their kids into the play area where you see again some 20-30 children and some 20-30 parents. And they think we're anyway in closed gates. We're in a gated community, so our community is protected. This is not true again, because many people who carry the virus, as I told you, are asymptomatic. There is no way you can find out who has this virus and who doesn't have the virus right now. We do not have the tests sufficient for that. So as you know, world over, the problem what we're saying is we're not testing enough. It only means that we don't have enough tests to test people who are not having symptoms. So only if you have fever, cough, cold, we're able to do the test. We can't afford to do it for everybody right now. So keep your children at a social distance and ensure that the lockdown goes on. Then going to other personal protective measures which parents can follow to help their children would be most important personal hygiene. Just because the kid is at home throughout completely locked down, it does not mean that they don't take a bath, right? So this is something which is again important, that they do, bathe with soap and, clean themselves completely every morning and hopefully even evening, because this is the summer and they are going to be sweaty even though they're staying at home. So ensure that baths are very important, right? And a lot of kids, I know kids were saying, why should I bathe, doctor? I'm sitting at home all the time, right? But it's not true. So ensure that they bathe. It has been shown that just taking really hot water baths actually can help us clear a lot of pathogens. So though it is summer, getting your child to have good hot water baths can actually help you clean up the virus and probably even kill the virus if they come in contact with it, right? So get your kid to maintain personal hygiene in that front. The second important thing is with respect to hand washing. This has been time and again spoken to by doctors that hand washing is a must. After your kid touch any object or your kid finishes eating, before eating, any activities, try to make your kids keep hand washing as much as they can during this season. And the hand wash should be done with soap, not with just plain water. It has been shown that soap is one of the important factors which can kill the virus. So hand washing with soap is very, very important. And once you teach kids how to do it in a more systematic manner, I'm sure they will do it regularly through the day. Second is with respect to cough etiquette. So you have to teach your child that if you are coughing, how do you maintain a cough etiquette? As we know, the best way to teach them is to cough into your elbow, right? Kids don't even keep their hand. They obviously try to cough directly, right? But very important for us to teach them cough etiquette, that every time you cough, ensure that you keep your elbow like this and then cough into your elbow. This is important because you know that kids are carriers. Kids are the ones who can potentially infect the adults in your house more than themselves getting infected. They might be carrying the virus already, but they're the ones who can infect others. So cough etiquette is very important. Cover your mouth every time you cough. And if anybody in your family has fever, cough, or cold, you need to quarantine them away from the rest of the family, right? Because this is very important mistake we make, saying, how are we going to separate people from within the household itself? You can give them a separate room where they are given all their facilities, at least for the next 1 week to 2 weeks. The next point we talk about is with the mask. A lot of parents ask me, should my kid be using a mask all the time, doctor? What is the advantage of using a mask? That WHO has clearly released guidelines that the mask is not going to help you, especially when you're sitting at home, right? It's just going to irritate the kid a lot more. I know a lot of kids are coming because they're forced to put on the mask, and I can see them literally crying with that mask stuck to their face. It doesn't help. The mask helps only if you're going out, one, which you are not supposed to be doing anyway. And secondly, if the child itself is coughing. So if a child is coughing, then what is the advantage of the mask is that it prevents others from getting the infection. That is the main advantage of the mask, not to protect you, but to protect others from getting the infection that you have. So that way the mask will help, especially if your kid has a cough or a cold. And in many households, you're not going to have one kid, you probably have two kids, and it's very difficult to keep both the kids away from each other. So here, if one kid is having even a mild cough or cold, that kid should definitely use a mask so that the other kid does not get affected with the cough or the cold, right? So these are the basic protective measures that parents can follow, and which will definitely help children from coming in contact with the coronavirus, and hopefully it prevents a lot of children from getting the virus in the future.
Okay, great. And I think, as you mentioned, this lockdown period and social distancing is going to prove to be a very interesting thing for, active, energetic kids. So how do you think parents can ensure that children are entertained and physically active during this outbreak?
So it is very important that we ensure that parents ensure physical activity, right? So I had a few parents come to me and say, doctor, you are completely against television and completely against using the mobile and tab. But what do you want us to do right now? Can you give us suggestions? What are we going to do keeping the kids at home, right? They can't go out and play, they can't do anything. And how are we going to keep them off television? So this is a unique problem that we're going to face in the next 21 days, right? We are obviously against children watching TV, but you're helpless. How are you going to entertain children in this period sitting at home? So first important thing for you is to draw a clear timetable and draw very clear restrictions as to how many hours of television your child is going to watch. So this is not difficult for us to do. You need to negotiate with your child and tell them, listen, we will allow you to watch TV because that is the best option right now. But how many hours are we going to allow you to watch television? So draw a timetable, tell them it's this many hours. These your TV time. This is probably your mobile, and this is probably your tab time or whatever, for them to get some amount of digital exposure, and important for us to restrict them to those times. Physical activity is something which you're going to find very difficult for kids to do at home, but you should start engaging in more activities. For example, things like skipping. Let's say it's a simple activity which can be done by kids at home. Set a period of, let's say, around 10 to 15 minutes and say, why don't you skip every day from 10 to 15 minutes, right? Kids get excited because they like skipping. They're the ones who like these kind of activities too, which can be done at home. They anyway are going to be running all around the house, which is fine, but get them off the couches. Try to ensure that they do some amount of physical activity. I encourage a lot of kids to do yoga, especially because I deal with children with asthma and lung issues. And it's the best time for you to teach your kids to do it. And maybe just half an hour of yoga activities keeps their mind much more calmer also. And obviously will not get restless because they're going on sitting at home. This might also help you keep them physically active. Most important for us is that keep them off the TV for a long time. It's a very, very big risk factor for them to start binge watching now, because it's going to be very difficult for parents to keep them off it. Keep a timetable, and that is the most important way that we can maintain some physical activity in children.
I'm sure parents are going to find great use of this information. So coming to communicating to kids about what is happening right now, is it important to let them know what is happening, what the current situation is? And if yes, how does a parent communicate to them and make them aware, but at the same time not get them anxious or worried?
So one thing parents need to realize is that just as scared as you are, kids are also scared, right? They also know what is happening. And today's kids are very much aware of their surroundings. They're very much aware of the things which are happening around the world, if not from the TV, from the internet. They already know what's happening, much better than what we knew when we were children, right? So today's kids already know what's happening with respect to the coronavirus. And they are also scared because you are scared. These kids are scared. They don't know how to express this fear about something which they have not seen in their with their eyes, right? So understand that your kids are anxious. So it's important that even if they're not expressing, they're sitting and playing around and look happy and joking about coronavirus, they are actually scared about it because they can see the fear in your eyes. They can see the fear around them. They can sense the sense of fear which is going all around society. Nobody is coming out, nobody's doing anything, and this really, really affects children a lot, right? So it's very important for us to maintain their mental health status also amidst this important scare of coronavirus. The first most important thing which I think even you should do is to stop watching news channels, right? And ensure your kids don't keep watching news channels and keep hearing all of them scream about coronavirus every single time, right? It's okay to watch comedy shows, it's okay for your kids to watch cartoons and just have fun, talk about other things other than coronavirus. Because the moment you put on the television, the only thing that comes on TV is about the coronavirus. The moment you go even on Facebook, the only thing that people are talking about is coronavirus, right? And I think this is something which you need to help kids break out of, right? So if you want to talk about a celebrity, the celebrity has coronavirus, right? So that's the only thing which kids are talking about. So get them to talk about other things. You talk about, this is the best time you get to talk to your children about interesting stories, get them to read a lot more books. And as we know, stories are the ones which make children go into a completely different world, right? So try to encourage them to read. You read stories to them and take them into those imaginary worlds that we probably lived in, which would probably take them away from the fear that they have right now. This does not mean that you don't come to the point. You have to talk to them sometime about saying that, yes, this virus is there in our society. It is going to probably go away pretty soon. But till it goes away, we are protecting ourselves and you are protecting yourself too. Why am I saying this? This is not going to be the first and the last time this is going to happen. Many times in the future, our kids are going to come into a society where this can happen again. We never know. But they should be mentally prepared to know that this is how you protect yourself and maintain personal hygiene, maintain social distancing and protecting yourself. So talk to your kids about it. Try to explain to them that this is a virus which is affecting older people. You tell them also that children are the ones who can transmit the virus to adults, though children are being protected. And you can also tell them that a lot of children are not really having severe forms of the illness. That will give them a lot of hope. You tell that to them. You say that, see, there are no kids across the world who have been affected very badly. But the reason we're protecting children is that they can transmit this infection to older people. An important point is that children should be very careful around their grandparents, right? Because as we know that the older population above the age of 60 are the ones who are the most prone to get coronavirus and the severe forms of it. And the ones who transmit it the most are the grandchildren who these grandparents are coming in contact with. This was a unique problem, which there are quite a few research articles which are saying, is that the reason why Italy got so severely affected? Was one, they had a huge population of grandparents and older people who were taking care of their grandchildren. So these were coming in contact with grandchildren, which is also going to be seen in India, where a lot of grandparents are the ones who are taking care of the grandchildren. So it's important that these children understand that if you're coming in contact with your grandparent, ensure that you wash your hands, ensure that you are personally maintaining your hygiene, ensure that if you're coughing, don't go near your grandparent for some time. It is fine, because you stay away from your grandparents for some time if you're having a cough, cold, or fever, because they need to be protected from the children more than the children themselves. So this should be a good motivating message to a lot of children, and keep them positive. Ensure that you keep them happy, keep them positive, read stories, sing songs. These are things which you can do at home and make them do a lot more positive things. If your kid has any hobby, as you know, many of them have lost track of hobbies because the exam season has just got over. Get them back to all their hobbies, right? I encourage kids playing musical instruments, painting, drawing, any form of hobby. I have nieces who love to bake. I have kids who love to paint. These are things which they can definitely do. Encourage hobbies as much as possible. Get them to start a musical instrument if they've never tried one before. Getting a small piano and ask them to try it out. There's nothing wrong. There are enough YouTube videos for them to learn from, and I'm sure this will keep them positive and motivated.
Right. While communicating about the current situation is very important, sometimes shutting off and keeping them distracted with activities that are likely to engage them and excite them is the way to go. One of the things you mentioned was immunity. So coming to immunity, it is something that we at HealthifyMe also realized is an important part of this issue. So when it comes to children, how can a child's immunity be improved during this time? Yeah.
So I think it's important, as I said, that we try to avoid junk food as much as possible in children, because they can very easily binge eat on cookies, chips, and bread and all that which is available at home. Ensure that they take a lot of fruits as well as vegetables, right? So fruits and vegetables are rich in antioxidants, and these definitely help us protect against all the infections. So get them to eat a lot of fruits and vegetables, right? So this is something which is very, very important. Second thing, as I told you, is to maintain physical activity. Physical activity itself releases a lot of positive chemicals in your body, which maintains your immunity. So ensure that they do physical activity. As I said, stretches like yoga, exercise are very important. Third important thing which we are going to miss out on during this period is vitamin D, right? Because vitamin D, as we know, is the most essential component for our body's immunity and protection from infections. But vitamin D, the main source of vitamin D is the sun. So where are you going to get the sun if you're all going to be locked out? But this we should not forget, that yes, it does not mean that you don't go to the terrace and get your dose of sunlight, or go to your balcony and sit in the sun. It's summer now. Summer is the best time where you can actually get your vitamin D. So encourage your kids to play in the balcony, probably if you have a balcony, or get them to, when there's nobody in the terrace, you check, or maybe in your apartment, you all can split times as to how many people are going to the terrace at each point in time. Take them to the terrace and ensure that they play in the sun a bit to get their dose of vitamin D. This is one of the important problems we might face after the lockdown, is that many people might become vitamin D deficient, and vitamin D deficiency predisposes us to a lot more infections, right? So get sunlight. You can't go out, obviously. Go to your balcony, go to the terrace, and get adequate sunlight. So 3 important things that we need to maintain is the diet. Ensure that they eat home-based food, healthy food, predominantly rich in fruits and vegetables. Ensure that they maintain their physical activity in whatever ways that you're going to try to keep them physically active. Ensure that they get their dose of vitamin D. And these are the 3 main things which could probably keep your child immune and keep them strong.
Okay, I think that parents will be encouraged to hear that improving a child's immunity is within their reach. It can be as simple as diet, physical activity, and getting more sunlight. So I think that's great. And lastly, do you have any special message or advice for parents with young children? Anything that you would like to communicate with them at this time?
See, the first thing I would like to tell you is, I think all parents and everybody need to get over your sense of fear. I mean, don't worry, this seems like a difficult time for all of us, but this is going to pass, right? And we're all confident that this period is going to pass quite quickly, and we will get over this problem pretty soon. There are a lot of scientists who are beginning to say that the peak of summer is going to help India actually fight the virus much better. So we do have a lot of positives which are coming in our favor right now. The summer itself, which we were cribbing about, might come in the favor of our country and protect us from the coronavirus pandemic. The 21-day lockdown will definitely bring down the numbers significantly, and hopefully we will tide over this crisis pretty soon. So stay positive. I mean, it's very important that we stay positive during these times, and that is my main message for everybody, is that agree this has created a sense of fear. Sitting within four walls makes you more gloomy and think of all the worst possible scenarios that can happen in the world. But keep yourself positive and keep your kids positive, because if you stay positive, that's when your kids are going to stay positive and happy. The fact that you are getting affected by this and are getting sad and about the whole thing which is happening, your kids can pick it up and your kids will also get affected by this. So as a parent, it's important for you to stay positive and indirectly keep your children positive and tell them that we are going to pass through this time and we're going to be back to normal pretty soon. Another point I wanted to make, I'm seeing a lot of people, especially young parents and youngsters, who are taking medication which is not completely recommended. And this is a trend which is going across, which we are getting reports of, which is not officially documented, but we are seeing parents who are taking hydroxychloroquine or chloroquine without prescriptions, presuming that this is going to protect them from the coronavirus. Please do not take the risk of giving it to your children, right? You might think that you're going to protect your kid from this, and you might think that this is the solution. There is absolutely no evidence for this right now. There are no randomized controlled trials. So do not medicate your child thinking that if you give any of this particular medication, it is going to solve your problem. I don't think you as an adult should be taking it too right now, because unless your doctor prescribes it, you shouldn't be taking any form of tablets on your own. But it's happening all across the city, all across India, where a lot of people are beginning to take chloroquine and hydroxychloroquine. So please do not give it to your children.
Okay, I think that's an important word of caution. So thanks for that. Thank you so much, Doctor. This was an incredibly informing session. So thank you.